Hi, I'm Dr. Michael Gartner, double board certified plastic surgeon. Today I've been asked to give my reaction to an episode of Botched, where a patient actually has stacked implants. Implants usually come up to 800 cc's. The implant company will allow you to get an 800 implant and fill it a little higher so you can reach the 900 level. But in the United States of America right now, they're not making custom implants. One company, Mentor, did just come out with a 1500 cc implant, but that's only for reconstructive purposes and not cosmetic purposes. I do a lot of breast implants. I have had a few patients who wanted the really extreme large result and asked if I stacked implants. I've never done that. I've seen one case in my residency, which was about 27, 28 years ago. It did not look good at all. It looked very weird, very bizarre. So it's not recommended. The companies who sell the implants don't recommend that too for the validation of their implants, meaning that if you stack implants and you have a problem with your implants, if they find out that you're stacking them, then they will not cover the ruptured implants. Many implant companies do give a warranty. If the implant wears out, especially within the first 10 years, you will get a new implant. They also cover special warranties for capsular contracture, which is the thick scar that can happen around the implants, which in my practice is about 1 or 2%. Most people develop a thin balloon scar where your breasts are so soft you don't know it. When you get a capsular contracture, it's like having an orange peel around your breast. It gets thicker and thicker, harder and harder. Lift the breast up to a higher position. So with larger implants, you do have a higher risk of that. You do also, with larger implants, have less tissue coverage, so you can feel the edges of the implant.
Brittany.
Hello.
Dr.
Nice
Nassif.
to meet you.
Hi, Brittany. Terry Dubrow.
I'm super nervous to tell Dr. Nassif and Dr. Dubrow that I have 4 implants in. It kind of feels like telling my mom.
4 implants in, 2 in each side. Isn't that crazy?
So take us back. Tell us about the genesis of all of this.
Okay. My first boob job was 600 cc under the muscle.
Big.
Yeah.
600 cc's is a big implant. The breast has a certain architecture and certain framework, and you can stretch it out a little bit wider than that. But with most people, you may not be able to fit that in. Sometimes it takes 2 surgeries to fit that in. But people who have a large frame of the breast, you can do that. I've had quite a few patients who had large frameworks of the breast and they wanted larger implants, and I was able to fit that in, but those are good-sized implants.
Immediately after, my implant was actually poking out of my right breast. Yes, and my doctor said he wouldn't touch it and it wouldn't be worth fixing. So
when you have a problem and your doctor says he doesn't want to touch it, it wouldn't be worth fixing, means he doesn't want to fix it and he doesn't want to take care of you anymore. So that's actually disappointing to hear that. It'd be interesting to see what kind of surgeon she went to. With those type of problems, there are ways of improving that or fixing that if that were the case. Usually an implant under the muscle, if done properly, that never has that issue. So I wonder the first time around if she went to actual board certified plastic surgeon by the American Board of Plastic Surgery. There are surgeons in other states where basically they can just take a weekend course, a general surgeon, family practitioner, and they get a sham certification, which is called the American Society of Cosmetic Surgery. Sounds impressive, but these aren't real plastic surgeons. Now they call themselves non-core plastic surgeons who learn how to do some of these procedures in a weekend course, and then they start doing them in their offices, which is highly dubious place to do this. I have a fully certified operating with all the bells and whistles. I get annually certified at its actual surgery center. I only have state-of-the-art facilities and state-of-the-art equipment. I've been doing breast augmentation for a long time. I do a large volume of breast augmentation, and it's disappointing for me to hear that she had an issue and she was kicked away. And that leads me to believe that this was done by an amateur, quite honestly, who passed himself off as an experienced plastic surgeon.
I started to seek out like other doctors and do consults. And at this point, I knew right away I wanted to go bigger.
You thought, if I have to get this fixed, I might as well go bigger while
That's
you're there.
exactly what I thought.
So what happened?
I met a lot of great doctors who turned me away.
Yeah.
And I had a very specific number in mind, and
Which was what?
it was 1,300 cc's.
Any legitimate board certified plastic surgeon with a patient who has 600 in wanting to go to 1,300 would definitely turn that patient away. No doubt about it. Only a dubious possible plastic surgeon without a lot of experience, desperate for cases, quite honestly, would probably take like something like that on.
Silicone implants come in a maximum of 800 cc's. Anything larger than 800 cc's puts the tissue under too much tension and predisposes you to thinning of the skin, atrophy of the breast tissue, or significant capsular contracture. It's like putting a bunch of people in an elevator that meets the weight capacity. You can do it, but do you want to be in that elevator?
That doctor is correct about all those things. Those things don't necessarily happen right away. And when they do happen, it's many years down the line where it thins the tissue. It also depends on the thickness and strength of an individual's tissue. If someone has thick tissue and very strong tissue as opposed to very thin skin, there would be a better candidate for a larger implant. The thin skin patients, it's best to go to more of an average size instead of these crazy large sizes.
He said we could stack silicone implants.
Stack?
Yes.
Two
stack.
implants?
Yeah.
Each side? Stack implants? You have 2 implants in
Yes,
each breast.
I do.
One above and one below
Right.
the muscle.
So one's below the muscle.
You go to the implant company inserts, it specifically says, do not stack implants.
Oh my God.
It's forbidden.
Okay, now that's a company rule. They do not recommend it. It's like putting tires, these massive large tires on your car where your car wasn't made for those large tires. So these car manufacturers would say it's forbidden or not recommended to put this large tires on, but people are doing it. If insurance companies know of that, if you have any problem with your implant, it won't follow the get warranty and your implants won't be warranted. Like I mentioned before, they have warranties on implants and it would devalue any chance of getting a warranty. I would not recommend stacking implants. If you want rather large implants, I would put the largest ones that the manufacturers allow, which is 800. You can with saline go a little bit larger to fill that 800 cc, possibly in the 900 range, but you really can't do more than that. If you want to learn more about this, if you want to exchange your implants and go bigger, or if you want to downsize, go smaller, or if you want to take them out completely and do a lift, I do a lot of that. I'd be happy to see you as a consultation. I'm happy to talk to you about it. And we'll be showing more of that content on my video channel here. So subscribe and hit the notification, and we'll see you at the next video.